Thanks for being with us today. We're here with members of the Yes on 108 campaign with the Oregonian Editorial Board. I'm Helen Jung, I'm the opinion editor, and Laura Gunderson, the Director of Public Interest and Accountability, is also with us. I'm wondering if you all can start off by telling us a little bit about the measure and what it would do, and to also please introduce yourselves as you do so.
Wonderful. Well, thank you so much for having us here today. My name is Christina Bodemer. I am the Oregon Government Relations Director for the American Heart Association. This has been a top priority for us for several years now. And we thought we'd start today with just a quick slide presentation of some of the highlights of the bill. So really what we'd love to do is start with why. In Oregon, we're facing a youth vaping epidemic. Our vaping usage increased 80% between 2017 and 2019. It is very easy to forget, given the current pandemic, that there were actually very serious health epidemics happening before our current context, and this was one of them. Youth who vape are 3 times more likely to start smoking, which is one of the main reasons why we wanted to make sure that we included vaping in this important measure. And smoking is still the #1 cause of preventable death in Oregon. And unfortunately, we all pay the cost. The cost of tobacco related and smoking related healthcare costs is $1.5 billion a year for the state of Oregon. So looking at what is Measure 108. So what it does, it will reduce youth vaping and smoking by pricing young people out of the market. Increasing the price prevents them from wanting to purchase it. Some of these products are very cheap right now. If we prevent people from smoking, we reduce death and illness because they are not becoming addicted to a deadly product. And if we reduce death and illness, we reduce our tobacco-related healthcare costs. The other nice benefit of how this package has been created is it will triple the funding for prevention and cessation programs in the state of Oregon, and we'll dive a little bit more into what that means in a little bit. And it also provides important stabilizing funding for the Oregon Health Plan, the state's Medicaid plan. And of interest, it also aligns our state taxes with other West Coast states. It has been several decades since Oregon has had a commercial tobacco tax increase, and will be now starting to tax vapes as well. So this is just a small snapshot of kind of the industry that we are up against. Reynolds American is a very well-known tobacco industry company. A lot of people have heard about Juul, but this is one of just the many tactics that we see from tobacco. They've partnered with artists to make their wraps of these products pretty and enticing to use, so they look like something that someone would want to have in their hand, and they sell them for less than $1, which is just insane. So what Measure 108 does is it increases the price per pack on the commercial rolled cigarettes by $2. It starts a first of its kind wholesale tax on e-cigarette and vape products. This is the first tax on vaping and electronic cigarette products in the state. They're not currently taxed at all here. And it increases the cap on our cigar tax by 50 cents. So of course, a tax will have revenue raising capability. So we wanted to provide a brief snapshot on what that new funding projections and where it will go. So in this current biennium, the projection is to raise a little over $111 million. And the way that the measure is broken out is 10% will go to those prevention and cessation programs, and 90% of it will go to the Oregon Health Plan. So as you can see in that second column around the next biennium, this has very quickly able to triple the amount of money we are spending on tobacco prevention and cessation programs, and provides an incredible investment into Oregon Health Plan. And the bottom 2 lines are actually just talks about the federal match and kind of the total investment in the Oregon Health Plan. So why we were starting to look at this particular combination of in this measure is increasing the price of tobacco and nicotine is the most effective way to reduce addiction. save lives and lower healthcare costs. So the projections we have are that there will be 19,000 fewer youth smokers. This will aid over 31,000 adults in their attempts to quit. And we know that 70% of all smokers currently want to quit in Oregon, and it will prevent nearly 12,000 premature deaths. So I think I've mentioned this. It will triple the funding for prevention and cessation programs, and it will provide important stabilizing dollars for the Oregon Health Plan. And really the benefit of having the prevention and cessation dollars is we want to make sure that any of that 70% who's ready to make the attempt to quit has the resources to be able to do it. But ultimately, the best smoker is one who never started. So if we can get youth to never pick up these products, that's really the reality, that's the future that we want to build. So this is just a quick graph actually of how effective increases in tobacco taxes are for reducing use. You can see the history of tobacco taxes over the last 100 years or so in terms of when we peaked in the 1980s, and then when we started really effectively using some of these tobacco control mechanisms like increasing the price to reduce use. This is just a very small snapshot of our over 250 organizations who have pledged their support to Measure 108. There are healthcare organizations, nurses, doctors, local businesses, chambers of commerce. Everyone is with us except for big tobacco. So that is the end of my brief presentation. And I just really, we're here today, of course, to request your support and your endorsement of Measure 108. And I will pass this over to Bianca, our lovely youth spokesperson.
Great, thank you.
Thank you. Hi, my name is Bianca Gergely, and I am a senior this year attending Westview High School. And when I entered high school 4 years ago, the popularity of vaping was undeniable. These devices are inconspicuous as they're small and easy to hide, and they lack that typical harsh chemical smell. So I've seen students take hits in the classroom, hiding behind laptop screens or inside their hoodie, or groups of students crowding in bathroom stalls to vape together. And I think that there's an immense pressure to vape, both from peers and from the companies that sell these products. And when I was in middle school just 4 or 5 years ago, vaping was never a problem. But now it's becoming an increasingly prevalent issue in many middle schools where students are as young as 12 years old. And these receptive young students aren't able to understand or recognize the danger that's really associated with these products. And I've seen the addictive nature of both these vaping products and cigarettes firsthand, both through my family in Romania, where young people are starting to smoke daily by the age of 15. And I've seen the destructive health effects of smoking in close family members. But I've also seen the destructive health effects and the addictive nature in my peers from school who started vaping when they entered high school, and just a few months later couldn't stay in a class period lasting 90 minutes or at a school basketball game that was a couple hours because they had to run to the bathroom to take a hit of their vape. And the low cost of these tobacco and vape products, with vapes not being taxed at all in Oregon and some of the lowest tobacco taxes across the country, the peer pressure is extremely hard to resist. And I believe that when something that's routinely purchased, like these tobacco products, will now increase in price, consumers are going to second guess their decision to continue purchasing a product that's only fueling an addiction. And with the more that they buy, the more reliant that they are going to become on these products, which only leads to increased spending down the line. An increased cost through the tax, both on vapes and any tobacco products, will make them less accessible. It will make people more likely to quit smoking and vaping and less likely to even want to start. It would also provide more prevention and cessation dollars to continue the fight against the tobacco companies. So with that being said, I'm making the ask that you will vote yes on Measure 108 to protect young people just like me across the state of Oregon. Thank you.
Thank you very much. Does anyone Or Elizabeth, is there anything that you want to talk about?
I would just add, my name is Elizabeth Shepard. I'm the campaign manager for the Yes on 108 campaign, and I'm really here today to represent the broad bipartisan and statewide coalition that we have in this conversation. And thank you so much, Bianca. I've heard you share your story before, but every time it's powerful.
And I'm Stephanie Vanderhey. I'm the communications director for the campaign. I'll be here to help take down notes and make sure we get you the information you need if we don't have answers right off the top of our heads. So thank you for having me.
Great, thank you very much. So one thing I was wondering is, do you know how many other states have a vaping tax, like similar to the one that's being proposed here?
So this is a growing kind of new mechanism. Most of electronic cigarettes they've only been on the market for a much shorter time than the kind of commercial packs of cigarettes. So states are still trying to grapple. I believe there are 12 states that currently have a vape tax, but that is a growing number as each state looks to come up with a solution to their own youth vaping epidemic.
Is there any data yet in terms of how effective it is?
So we have some assumptions based on taxation of commercial packs of cigarettes that we anticipate the same kind of reduction, but all of these taxes are too new, and unfortunately we need more time to really be able to have hard numbers on exactly what the cessation rates are. But if you look at other taxation measures, increasing the price is a very effective way of making addiction go down.
And one of the things I was interested in finding out is about the amount that's going to cessation and prevention programs. And you know, I think you said that it'll be 3 times, or it'll triple the amount that's going to it now. What is that amount? Do you know?
So the current investment in tobacco prevention and education programs is around a little over 16 million per biennium. So it's a little over $8 million every year for that particular program. So with the anticipated around $33 million, that will more than triple the investment in the state.
Is that sufficient? I guess, I mean, how effective has that 8 million been?
You know, we have seen some really great effective we have a great tobacco prevention education program, but of course, the more resources that we have, the more we're able to use, or the more we're able to do. One way to look at the effectiveness is, unfortunately, there was a time period in the early 2000s when the funding for the program completely went away. And we saw large spikes in increases in tobacco usage, and then it slowly started declining again when funding was restored. So they do incredible work around educating and kind of countering the tobacco-funded marketing around the state to make sure that youth and adults are not just seeing one side of the message, but the CDC recommended levels of funding are high. To really be able to counteract the over $100 million in marketing that tobacco spends in Oregon is a challenge.
And
so we've got to start somewhere.
And I'm sorry, you were saying that there are CDC recommended levels of funding for cessation prevention?
Yeah, there are.
And how does Oregon stack up against it? Like, what is the recommendation for Oregon?
So we are currently right around 20%. So with this increase, we'll be just over 50% of CDC recommended levels, which is, it's really actually laudable because most states aren't even close to that kind of investment. That Oregon has made a very big stand to make sure that we have dollars for tobacco prevention and education. And it's just really hard to hit those CDC numbers. But this would be a huge increase and a huge kind of step in the right direction towards that goal.
And just because I'm sorry, I'm not very familiar with the terminology. There's prevention, education, and cessation. I mean, are they all pretty much this, like one big pot of money, or is it, are these different pots?
So the tobacco prevention and education pot is they all go hand in hand. So I don't want it to think they all kind of complement each other in the work that they do. So even if there isn't a delineation between the three buckets, they're all incredibly important sides to this effort. Oregon has some pretty effective means in being able to provide cessation services to Oregonians, but clearly we still have work to do in making sure everyone has the same access to those programs. And tobacco prevention and education dollars are a lot of the youth work that we do in making sure that we're countering that marketing.
And this revenue will go to all three efforts?
Yeah, it's actually in the language around prevention and cessation efforts.
Christina, I just wanted to follow up real quick. I just want to make sure I had those CDC numbers correct because I thought that was interesting. You said we're currently at 20% and this would take us to 50, or currently at 30?
We are currently just over 20%. I can follow up with the exact chart around what the recommended levels are for every state. Okay. And this will put us over 50% of recommended levels.
That's great. Thank you.
Mm-hmm.
And is there a sunset on this tax, or is it viewed as a permanent tax?
Yeah, this is a permanent tax. Really, the reason why we've kind of seen a stagnation in rates that we have is it's been over 2 decades since Oregon has seen an increase in our commercial tobacco tax for those packs of cigarettes. So we haven't seen the same reduction in other states who have more recently increased their tax. And then we have this amazing opportunity to really be addressing this youth vaping epidemic by increasing the price of these new and emerging products from the tobacco industry.
And how will this compare to Washington and California if this tax is enacted?
So that's a great question. It actually kind of aligns us with other West Coast states and putting us right around the same levels that they are. It'll still be just a little bit less because of not having a sales tax in the state. In addition to the excise tax on the tobacco product in both Washington and California, they have sales tax, but it puts us much closer to parity with our neighboring states.
So the majority of this funding will go to support the Oregon Health Plan, is that right?
Correct, yes.
And is there any discussion about what happens if these cessation and prevention programs are really successful?
Well, you've just described my dream world of, the idea behind this is to reduce use. And that is actually how we will know that we were successful in our efforts. And why that's not of concern is if people are not smoking, their health improves and the burden on our health plan will be reduced. So it is a win-win that people are no longer smoking and it won't cost as much for the health plan to take care of the costs of a person who smokes.
And is there an estimate of what smoking-related health problems cost just OHP?
I believe we have those numbers. I'm sorry, the 1.5 billion, the larger number is the only one that's in my head. So I'm going to ask for an assist from Elizabeth, who was amazing me with her proclivity for remembering statistics earlier today. Elizabeth, do you have that at your fingertips?
I would like to follow up and verify, but I believe that the specific cost to the Oregon Health Plan is in the neighborhood of 350 million, but I would like to follow up. It's hefty.
And when was the last time the cigarette tax was raised?
I think it was in the late 1990s or the early, it was 1999, I think. That will be something we have to look up. It's been a long time.
So long we can't remember.
Let's see. And has there been, any significant opposition? I saw just that there hasn't been any formal campaign against the effort. Are you hearing much from anyone on this?
Yeah, frankly, I wish there was opposition here to answer that question for me, but I will have to do. At this point, I think that the opposition has seen what we're seeing in this campaign, which is that Oregonians overwhelmingly support this measure. Over 70% say that they will vote yes on Measure 108, and that's across political lines. So, given that, in addition to the grassroots bipartisan coalition that we know, you know, an industry like the tobacco industry can't really cultivate in the same way that we can. We're uncertain that they're going to approach, but what we also know is that we have to continue to be ready, because there's precedent of the tobacco industry coming into fights like this and being able to put in $30 million into a PAC in the time span of 24 hours. So, you know, we remain ready, our coalition remains ready, but at this time we have not seen that sort of activity.
I have to be honest, I don't have any other questions. Laura, is there anything that you want to ask about?
No, I can't think of anything either, though. I always like the usual of what have we not asked? What is it? Is there anything else that we should know that we haven't covered?
Not to make it seem like I'm able to pull these out of thin air, but I happen to remember where the document was saved on my computer to answer your question of the last time we raised our tax. The last meaningful increase of a tobacco tax was in 2002, but not to be outdone, Oregon is one of the only states that reduced their tobacco tax, and that was in 2004. So we raised it by 60 cents in 2002 and then dropped it by 10 cents in 2018. I think we are the only state that gets to have that unfortunate honor of reducing their tobacco tax. And then there has been a couple, there's a couple cents that we've added on over the course. So we haven't meaningfully increased our tobacco tax since 2002. And by meaningful, I mean an increase that is high enough that you can see the effect of reduced use. There has to be a certain price point that they can't counteract with couponing and other industry tactics that they can use to counteract.
How much is it a threat of, or to get it over, you know, by, you know, Amazon, or I don't know, just like to order over the internet? Is it possible to do that? And is that a significant potential way that kids might get around that?
So in 2009, the federal government actually passed, it's called the Pact Act, and they made it illegal to actually send cigarettes in the commercial mail. They are working to make sure that electronic cigarettes are not that way, but the data that we have is really showing that youth are getting this from peers who are getting it from, unfortunately, from stores who are not following the legal age requirements. So it's just not, it's a very common talking point around online sales, but it's not where the data is showing us that youth are getting these products.
Great. Well, thank you very much. I really appreciate your taking the time to tell us about this campaign or about this measure. Does anyone want to, is there any kind of anything else that you want to add, or any wrap up that anyone wants to do? Okay, great. All right, thank you very much. I really appreciate it.
Thank you so much for your time.